I believe that we are improving patient care. Fresno Unified School District is trying to be proactive about improving health care. And they're aware that for every dollar that you put into preventative care, you reap at least $2 in savings from medical costs.
I think before PCMH, it was pretty much feeling like I had to do it all myself without the help of a care coordinator, or without even my front office thinking about the importance of having patients follow through with their labs or reaching certain goals.
But having the patient take an active part in what's going on, and instead of being paternalistic and saying you need to do this, 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 I'm saying these are the tools that you can do to get to this place, to improve your weight, to improve your hemoglobin A1C, to lower your cholesterol. It's become much more collaborative than the old paternalistic model. And the other thing too is we're trying to do more comprehensive care instead of doing an episodic model where you're just taking care of people on an acute basis. We're trying to do a continuous model.
So in the PCMH model, some things that patients do differently now is they're more aware of the preventative screening. Colonoscopies, mammograms, and just knowing that how well those can protect your life.
The patients actually can see how their progress is for their weight, their blood pressure, and it helps their total care, and by us making sure that we are doing the preventive care that's needed for each of those patients. We've always been a very friendly office, but it has helped to be able to look at those things and bring the patient into that conversation with what is needed to be done, and gives them a better feeling, I think, of they have a little more control of their health care.
I find that people, if they can own something, even just a little bit, they're more apt to follow through, take care of themselves, which translates to better outcomes overall, less hospitalizations.
I do not feel that we'd be where we are along the patient-centered medical home without the help of Lori, our quality improvement person, and Raquel, our complex care manager. They have done splendid jobs. Lori cheerleads us along. She has the big vision for where we're going and trying to nudge us along to get there. Raquel, she is tireless in trying to contact patients.
The complex care manager is a care coordinator position, and we have Raquel with us, who's a RN, and she brings a lot of good background experiences. It's been very efficient. She does a lot of case management for us. In particular, I've been very pleased to have feedback from patients that I have in my panel that have been hospitalized, and then I never used to get their follow-up reports. I never used to know they were even in the hospital. And now with our patient care coordinator person, I do receive reports. So I know that a person has been in the hospital, and surprise of surprises, I'm actually getting them in within a week for follow-up, which is pretty important.
Well, my role is very unique because I do a lot of the outreach, patient outreach, and that's meeting patients where they are. Benefits to having someone like myself, a complex case manager, I believe would be the patient outreach, either before a visit, maybe if there's a year before the patient, it's been a year since the patient's been in to being seen, or a follow-up call after a visit are huge and very important to patient engagement and also compliance. So a critical part about doing outreach for the high-risk population that was identified in this project was re-engaging patients, bringing them back into the offices for whether it was a preventative visit or a follow-up visit, educating them on the importance of getting their annual labs done, having mammograms done.
So we really do need good support, financially as well as computer-wise. You've got to have a good registry. If you don't have a good registry, it can't work. So it's not something that you can just jump into. There has to be a lot of planning that goes on, and you have to have good support and good organization behind you. You have to be able to access patient information. And of course, if you're not on electronic medical records, it's not going to work. And not every electronic medical records is going to give you that registry. The teamwork approach is trying to get everyone to do just about anything they can do in the office and to function at their highest level.
Well, I think that it's really brought our office together as more as a work team.
The change that we've had in the office since we've started with the patient-centered medical home is that our group is working together more as a team. We are making sure that from the patient walking in the door being identified as to the patient-centered medical home patients, that they are identified there and that goes through to the medical assistant as they're rooming, so that we make sure that all the information that we can get for the registry is gleaned at that time.
It's always really nice to see the light kind of start to shine in their eyes when they start to understand the concept of prevention and not just seeing the doctor for not feeling well. And I think that's part of the missing equation for trying to keep the patient population healthy these days, is trying to get to the level of the patient to help them to understand what health and wellness really means, and not just take care of the sick moment.
That's the change. It's not coming in just for a prescription, but for the education as well. Patient satisfaction has increased, probably more because the patient feels that they're a part of this. And there's knowledge is power.
Responses from patients over the phone primarily have been very positive. A lot of the feedback that I receive is that, wow, my provider really does care. My doctor does care about me. Thank yous.
We were able to see lots of positive gains in reaching evidence-based goals for their patients and utilization of, for instance, mental health services, to the point where there was a savings for them in cost utilization per person.
It's an investment. Okay, and it's an investment in doing the right thing. It can transform medical care in America.
It has brought more joy, or a lot more joy, to my career, to be able to see this transformation from care that has been very, as you mentioned, fragmented, to one that's much more coordinated. It's been a pleasure to share that with other people. I just think that it is the wave of the future. It's the right thing to do for people. And I've seen joy in people having participated in it. So that in itself, I think, is wonderful.